I'm Nick Arnold. I'm one of the internal medicine chiefs for the 2020-21 academic year here at the University of Iowa, and I'm going to talk to you today a little bit about our schedule and how it sets up in our residency program here at Iowa. We utilize the X+Y system for our scheduling, and what that typically means, as most of you know, is that you have a set number of inpatient weeks followed by a week of outpatient care. And here at the University of Iowa, we do 4 weeks of inpatient or some sort of inpatient style rotation or an ambulatory block where you could do outpatient services for 4 weeks. And then you do your dedicated Y week with your continuity of care patients. And the interesting thing about our curriculum is that on your Y week, you get 2 half days across the course of the week that are dedicated to specialty clinics. And so some of those are to meet ACGME requirements, but primarily we use those to get you into clinics that you have potentially a career interest in, such as cardiology, pulmonology, endocrinology, rheumatology, geriatrics, palliative, whatever you would like, we can probably get you into. And so each Y week you will have a dedicated half day for quality improvement project time. And so each Y week group, whether you're at the VA or if you're out at Iowa River Landing, which is our university affiliated clinic, your team will have a QI project that you work on throughout the course of the year, and you get a dedicated half day across the course of that week to work on your QI project and the things you need to get done. And then we also have built in an administrative half day, which is a half day for you to catch up on notes, to do paperwork, whatever you need to do to catch up from the Y week or anything that's left over from your inpatient block that you just completed. We do not specifically allow interns to do 24-hour calls here at the University of Iowa. You do overnight calls in places such as our HEMONC service, our medicine psychiatry service, and the medical ICU, but we specifically do not allow interns to do 24-hour calls, and that has been something that our program has been pretty much in favor of for quite a while now, and we don't anticipate changing anytime in the future. Here at Iowa, you get 3 weeks of vacation, and we're pretty flexible with you in terms of when you want to take that vacation time. So if you choose to take 2 weeks of vacation and then a 1-week vacation later on in the year, or vice versa, you can do that. And also, if you know that you have specific things you need to do throughout the year or times that you need to be out of town, we even allow people to request 3 1-week vacations if that's something that needs to happen for you specifically. And we're happy to work with you to try and make everything work the best that it can for you. Since we're an academic institution, we have the Carver College of Medicine here, and our medical students are great to work with, and specifically during your 3rd year, you have the option to do part of our teaching curriculum that we engage with the medical students on. And so what that entails is it's about 4 weeks usually, sometimes it's less depending on where their holiday breaks and vacation time is, but you get to work specifically with our medical students and our sub-interns for a month, giving lectures and didactics and teaching them how to read EKGs and how to survive on the wards. So it's actually a standalone block, so it's part of the X+Y system. So it's a 4-week block, and then you would do your Y week after you do the teaching curriculum. So it's just you're completely dedicated to teaching medical students during that 4-week block. Obviously, being an academic center, we have a lot of research opportunities here at the university, regardless of what specialty you want to go into, or even if you want to stay in primary care or do general hospitalist medicine. There's plenty of research going on, and so you can engage in that anytime you want throughout the 3 years. The big key point for incoming residents is that during the intern year, there's a lot of rotations we have to get you into for ACGME purposes, but then during the 2nd and 3rd year, you can request up to 8 weeks or 2 of those blocks on the X+Y system be dedicated to research. And generally we have you set your project ahead of time with some sort of research mentor or a fellow or something of that nature. And then that 4 weeks that you have is completely dedicated time for you to work on collecting data or analyzing data or working on your manuscripts or finishing up a publication that you've been working on throughout the prior year.